Many people wonder why it is or how it can be that somebody can keep using a drug or alcohol when they know it's killing them. They've been diagnosed with cirrhosis of the liver, they've had a few overdoses, and they're intelligent people. But they keep using in spite of the very powerful, life-threatening things that are occurring in their lives. Almost like every week or two or month, they could be at death's door and still they use their drug of choice. This is a phenomenal occurrence, but when you think about it from the perspective that it is in that addict's or that alcoholic's mind, that historically this drug has made them feel wonderful. It's been awesome. Like, I kind of like to joke in a way, but nobody gets to feel as good as a heroin addict. In normal life, we never get to feel that good. If your best day is maybe here, as a healthy, functioning adult, a heroin addict's use might be here. Something that you might not be able to reach if you won the Nobel Peace Prize. But it doesn't last, of course, and if you won the Nobel Peace Prize, you might feel good for the rest of your life to some extent. But it's not as intense. And then you take things into consideration that oftentimes people, like I've said before in other videos, people have a lot of emotional trauma and emotional malnourishing experiences developmentally that the drug relieves. So if you're starting out down here and then you take a drug that makes you feel up here, the distance you've traveled is huge. That's a really powerful positive reinforcement history. If you're someone that has kind of an average amount of emotional trauma or emotional malnourishing experiences, you've been pretty comfortable emotionally, and you do some drug like heroin, you'll go from here to here, which is still a very high. But someone who's way down here that goes all the way up to here, that's a memorable experience that gets that's active information in your emotional software program, and that's what keeps drawing you back. Not to mention that you've never really experienced, if you've been way down here, you've not necessarily ever experienced doing anything that was effective enough to even get you to here, let alone to here. So you're programmed to, and compelled by that experience, to keep going back to the drug even when you're faced with life and death situations. It's one way of looking at it.